Ever wondered about the early signs of autism? Well, today, we're diving into this important topic. Autism, also known as autism spectrum disorder, is a complex neurobehavioral condition that includes impairments in social interaction, developmental language, and communication skills, combined with rigid, repetitive behaviors. The term spectrum refers to the wide range of symptoms, skills, and levels of impairment or disability that children with autism can have. Autism starts in early childhood and lasts throughout a person's life. It can be diagnosed as early as 18 months or even younger in some cases. Most cases, however, are not detected until a child is about 2 to 3 years old. So what are the early signs of autism? The earliest signs of autism involve the absence of normal behaviors, not the presence of abnormal ones, so they can be tough to spot. Parents often first notice that their toddler has not started talking yet and isn't acting like their peers. One of the hallmarks of autism is impaired social interaction. As early as infancy, a baby with autism might be unresponsive to people or focus intently on one item to the exclusion of others for long periods. A child with autism might appear to develop normally and then withdraw and become indifferent to social engagement. Children with autism also may have unusual responses to sensory experiences, such as certain sounds or the way objects look. Each of these symptoms on its own does not mean that a child has autism, but taken together, they may indicate that a child is on the autism spectrum. Now let's talk about language. By the age of 2, most children can string together phrases. Children with autism might not reach this milestone or could lose their ability to put together sentences. Repetition also plays a big role. Children with autism often have a strong desire for routine. They might want to always travel the same way to school or insist on eating the same food for every meal. Remember, these signs can occur in children without autism too. But for children with autism, these are more than just passing phases. They are persistent, consistent, and disruptive to their daily functioning. So, what do we do if we notice these signs? Early intervention is key. If you suspect your child might be on the autism spectrum, consult a pediatrician or a child psychologist. They can guide you to appropriate testing and resources. In summary, the early signs of autism can include impaired social interaction, delays in language development, repetitive behaviors, and unusual responses to sensory experiences. These signs can be present as early as 18 months. If these signs are persistent and disruptive to a child's life, it's time to seek professional help. Remember, every child is unique and they develop at their own pace, so don't panic if your child is a little late to hit a milestone. But if you're concerned, it's always a good idea to seek advice. With the right help and support, children with autism can grow up to lead happy, fulfilling lives. This is why understanding the early signs of autism is so important. It's not about labeling, it's about helping each child reach their full potential. That's all for today. Keep learning, keep growing, and remember, knowledge is power.